Welcome back to the PCC podcast. Today I have a really special guest, and this is like a very full circle moment because this was the first guest that we ever had on the Barbell Lifestyle podcast. We were like 190 something episodes into that podcast, and that was episode 7. And so it's been a while. We were just talking off air about how it's been 4 freaking years since we've connected. But today I have with me Nick Licamelli, who is a pain and injury management specialist at 3DMJ, and just really has helped me with my own injuries, aches, pains, and lessons that I still like hold dear to my heart to this day. So I'm really excited to talk about pain and injuries with all of y'all and how it applies in the context of your health, your wellness, your journey. So welcome, Nick.
Thank you for having me. And yes, it is an honor to be back. And I cannot believe that it has been that long. Yeah, wow. But that was the heart of COVID, and just so much has changed in the world and in my life and your life. And it's just so cool that we get to reconnect again. So happy to be here.
Yeah, I'm pumped. All right, well let's get our audience here a little bit more familiar with who you are, right? So could you kind of give us the elevator pitch of like who is Nick? What is your work, and I guess what has changed in the past 4 years since we last talked?
Yeah, so let's pretend this is a really long elevator ride. So I guess I should start. I'm a father of 3 little girls.
Oh wow.
Yeah, so my oldest is 5.5, my middle one is 4, and my baby is 7 months. So there's that. And I'm also a doctor of physical therapy. I own a practice. I have a clinic that I work in person. And then I also have a business where I treat mostly bodybuilders, weightlifters, but also some general population folks virtually. And that all started, the virtual aspect of that, through 3DMJ. So you may have heard of them before, but I started working with 3DMJ as their injury reduction and management specialist at about 2018. So that was life-changing for me. It was a great opportunity. I loved 3DMJ as a fan, and then when I got to work with them and continue to work with them, it's one of the proudest roles of my life. Not being dramatic either. I really do cherish that. So yeah, and now, like I said, I'm an owner. I work my full-time job in person, treating pretty much everything from athletes to older people, younger people, middle-aged people, surgeries, all that kind of thing. And yeah, I'm also a natural bodybuilder. I have my professional status in 2 federations, and I just had a competitive season last year in 2024. So I stepped off the Mr. America stage in October of 24. So now I am in a nice off season, and yeah, as far as when I'll be competing next, maybe 27, but there's no rush. I know the stage will always be there, and I'm just trying to take in as much as I can at this phase of my life, because it seems like
Yeah,
there's like a fire hose of just moments and memories and things that are just flying by. So I'm trying to rein it all in.
that's awesome. Yeah. Yeah, a lot has changed. I mean, literally like I think 2 kids worth of change on your side. So,
Yeah.
I guess on the philosophy side though, I'd love to know cuz like I've always just really resonated with your perspective about pain and injury. Has anything changed in your philosophy, either personally or professionally, in the past 4 years?
Good question. I think what has changed perhaps is I am less quick to throw things away, like manual therapy and all those kind of modalities that are like nails on a chalkboard to me.
Hmm.
But I do think that it's okay to use those things as long as the narrative around them is accurate. So, for example, if we use something like electrical stimulation just to deal with some pain, or foam rolling, or a massage gun, or
Hmm.
cupping, or things like that, or scraping, I used to roll my eyes at that. But I think it can have its place if it's explained the right way. Even like joint manipulations, like spinal manipulations and cracking joints. I think that if we explain that those things can provide a short-term relief in some pain, a short-term improvement in some stiffness, but it has to be followed with some kind of active activity, some kind of loading, some kind of exercise. Then I think it can have its place. And usually those things aren't too time consuming either. It's not like I'm spending 40 minutes with a patient that I see for an hour scraping their back or manipulating a joint in their back or something. It's usually a quick kind of thing. If they're coming in pain and they can't really tolerate the exercise, they can't really tolerate a squat or like a sit to stand to a chair, depending on the patient, then I don't mind doing those things. I think they may have their place, but the problem is that they get way overused, and the narrative then becomes that this foam roller is breaking up adhesions and releasing fascia, and which then is kind of a spiral down to crazy town.
Yeah.
So I think as long as we approach those things and explain that this is a short-term relief of some pain and stiffness, has a non-specific effect, but it's going to help us tolerate the exercises better, then I no longer roll my eyes at those things. I'm more open
Yeah.
to hearing the justification behind them. But off the top of my head, that's probably the one thing that has changed. Yeah, there's probably more, but maybe they'll come to me in a little bit.
Yeah. No, that makes a lot of sense. I feel like the evidence-based fitness community as a whole has kind of like come around in that way where like there was definitely a season of like definitely looking down on certain like practices and like kind of gimmicky type of things. And now it's more like, okay, I get that there's like a subjective that feels good, right? So like we're going to acknowledge that, but we're also going to insert the evidence here, right?
Yeah.
Um,
Yeah, and I think on the bodybuilding side of things and the training side of things, with all like my roles that I have and how my life has kind of changed, my training has also changed.
mhm.
And it's become much less rigid and way more flexible. Not that, so I get all the volume in that I have to do, but I may do like 2 exercises in the morning in my basement little setup and then finish the workout 9 hours later after my work.
Yeah.
And I'm totally cool with that. But the Nick, like from 5 to 10 years ago, like,
No, he would not.
no, no, no. Yeah. So I think life has a way of doing that. Like it has a way of forcing you to try something new and forcing you to test your limits and test your boundaries. And then when you run the experiment and you see, oh, like it's totally fine. Like I literally just stepped on stage and did a whole competition prep with this kind of like dad work training mix, and it still works. So it really helps. Just like how you asked the question, what has changed? I think I'm much less rigid in my training and way more flexible.
Yeah, I think that's also a great reminder because a lot of the women that we work with are like either trying to conceive, new moms, like in that same generation, right? And so a lot of times we struggle with that like lack of mental flexibility around like how something can get done. So I think that's a great reminder, even if
Yeah,
it's not related to pain.
yeah, and then it becomes okay. I only have a half hour this morning because whatever happened with the kids, or I got called. I had to go into the office a bit sooner. It's not even worth training because I only have a half hour, and what's the use? But in a half hour, you can knock off squats, you can knock off like some kind of bench press, and then you go to work, and after work you do some split squats on a chair when everyone leaves the office, and you get your volume in there. Yeah, I think when we're too strict and too rigid in rehab or training, I think it limits us from doing what we can do if we just approach it with a bit more open mind and a bit more flexibility.
Totally. Yeah.
And that's not to say like, oh, I'm really tired this morning because I was up all night with the baby, so I'm not going to train. Like way different than that. Like I think we're talking because you and I are crazy, and I've trained in a blackout before at a gym, which is not safe and not smart, but like this is the mindset that we're working with here. So for us to have a conversation about flexibility, I think we know that it's different than the average person being flexible with the gym. We're talking about like just breaking up your workout. If you can't knock it all out at once, you can spread out your volume throughout the week. Not to say like, oh, like I think I'm not feeling that great today. Maybe I shouldn't work out.
Totally. Yeah. And honestly though, the population that we've really begun to work with in the past like year or two has kind of been on that same wavelength. Like we're getting a lot of like former athletes and women who are like super type A and kind of like have already been doing all the stuff, like, and honestly are more along the lines of can take it too far and like
Mm.
to the point where their body is asking for some recovery and some rest. So I think it actually will resonate a lot, right? So with that, like in maybe like nerdy but simple terms, right? Because like I think our demographic is definitely a lot of like girls who like the science behind things, but at the same time want to be able to understand it fully. What is pain? Like, how would you describe that?
Pain is an experience. Pain can be impacted by many things. We know that pain is not always something structural that's causing you pain. Now, there's all ends of that spectrum. So if you are walking down the street and you step off a curb and you roll your ankle and it blows up and swells up and it's black and blue, we pretty much know that pain is probably structural because you just hurt your ankle. Most of the time, though, there are many things that can cause or lead to pain or contribute to the experience of pain. If you were to tell someone that there were shards of glass on the floor in front of them, and you blindfold them and have them walk on potato chips, but they feel that under their feet, they'll feel the sensation of pain. They'll feel that sensation like they're in pain when really they're not. We know that we can modulate pain by many different ways. The mental aspect, by doing some deep breathing, providing reassurance about pain. All those things can help decrease that experience of pain. Things like stress, physical or mental stress, can increase pain. And not to say that it's in your head, although it is, but not like by
Yeah.
not in like not like you're making it up. It's a real thing that stress can increase pain sensitivity. Sleep quality can definitely impact pain. The weather can impact pain. So all of these things, you can kind of look at it as this balancing act of load and then capacity to balance that load out. And load is all of these things that we're talking about. And then capacity is the ability to recover from that. And things that build capacity, sleep, hydration, nutrition, all those kind of things, stress management. And then the load is what we do to our bodies, what we do to our systems, the physical, the mental stress that we dive into, our training, our step count. If we help a friend move over the weekend, if we play guitar, all those things that cause our bodies to do things and work, that would be in the load side of the seesaw here, balancing act. So I think if we can approach pain like that, and if we have pain, don't just think I have pain in my elbow, so it must be my elbow that's causing me pain. Just think of more of a broad spectrum. And I can give an example of myself with when we first had my daughter, I guess my first daughter. I had pretty bad elbow pain. And now I may have told this story the first time around, I'm not sure. But I know better than to complain about elbow pain after my wife just gave birth. I know better than that. So no one knew about my elbow pain. But what happened was basically uh, progressive overload and graded exposure basically means that if you gradually expose a tissue or a joint or a structure to a certain load, it adapts to it. And if you make it heavier and heavier and heavier, then it gets more accustomed to it. It adapts, it adapts, it adapts. The problem was my daughter was growing faster than my elbow could adapt to it. So I developed elbow pain. I was having some issues doing pulling movements and curls and some things like that. So what I did was I took a look at my life and I said, now why would my elbow be hurting? Well, I'm carrying my daughter in my right hand because I'm lefty. So when I hold her, I always hold her in my right hand, my right arm, so I can do things like cook or clean or do whatever I have to with my left hand. So that's one thing. I'm overusing my right arm to hold my daughter. The second thing would be carrying diaper bags and strollers, which I never did before. Another thing would be sleep quality. Obviously, I wasn't getting 9 hours of sleep every night. So, and then my training just stayed consistent. I was just training like I was before. And so it kind of made sense to me that my elbow would be a little angry. So then what I did was I just modified my routine a little bit. I started holding my daughter in my other arm. I would throw the diaper bag on my shoulder instead of holding it in my arm. I would hold the car seat with two hands instead of one hand. I started using hooks with my grip in my training. That helped a lot with pulling. And sure enough, the pain went away. So I guess the point of that story is I didn't just focus on my elbow and the soft tissues around my elbow. It was more what is leading to this pain and how can I modify the modifiable things that I can in my life. And of course, if you go through that process, which I encourage your listeners to do, just make sure that there's no red flags. And that could be a nice segue into what a red flag is. If I was getting shooting pain down my arm into my hand, weakness into my hand, numbness, tingling, if I was getting pain that I couldn't really reproduce, I couldn't really make better with anything. Like for my pain in my situation, when I would put something down that I was holding, I wouldn't have pain anymore. It was just that simple. When I would load it, it would hurt. When I put it down, it wouldn't. Sometimes it's not the case. Sometimes people may have pain that wakes them up at nighttime. They don't really know why it's happening. Temperature, like fever, things like that. Then you probably want to go see a healthcare provider. But if it's just kind of predictable pain, like you have an idea what it's about, how it happened, then I would encourage you to kind of go through that process of seeing what things you can modify throughout your day. And that's what I'm here for too. Like that's what someone like myself would help you with.
Yeah, I love that. And looking at it from just like a whole life perspective and managing like total load. Because even with something like fat loss, right? Like even that we can look at that in the same way of like, okay, if the scale's not moving or we're not seeing the progress that we want, what are the inputs versus outputs in your entire life? And how can we balance those out for the right equation, right? So the same idea here of like, let's not hyperfixate on how many grams of spinach you're eating. Let's not hyperfixate on the elbow like joint specifically and just constantly rolling that out with a lacrosse ball, right? So I love that because I think it really comes from like a root cause perspective instead of a band-aid type of perspective. But I think it's just to bring it back, like I almost stopped you like in the first sentence that you said, because it's like, what is pain? Pain is an experience that's not always equivalent to tissue damage, was essentially the first thing that you said. And I was like, wait, we might need to pause here. Cause like, I think that is like a mic drop for a lot of people already. Right. And not like, we don't even realize that. And a lot of the masses, I think, just automatically equate if this hurts, it means there's something actually damaged in there. So what do we know now about that relationship between pain and tissue damage?
Yeah, great question. One of the conversations that I have every single day here in my office is talking people off a ledge when they come in with x-rays and MRIs. We have good research that shows us that what we see on an image does not always correlate to what the patient presents like. So we can have asymptomatic people, no pain, living their best life with herniated discs, rotator cuff tears, labral tears, arthritis, and never even know about it. So if someone were to go to a doctor with pain, so for example, say my elbow example was back pain, and I went to the doctor, didn't think about any other factors, just something's got to be off in my spine. Go to the doctor, and we do an MRI or an X-ray, and we see some herniated discs in there, which are kind of normal over the age
Very
of
common, yeah.
over the age of 35. We're going to have something in there. Now all of a sudden I'm fixated on that disc, and that's the problem. That's why I'm having pain, when really I've probably had that for the past 10 years. So yeah, that conversation is constantly had, and it's almost reassuring. Depends on the person though. Sometimes it's frustrating for the person because it's almost it's almost comforting to identify something as the cause of the pain. So I have to kind of tiptoe around that conversation because that's what they come in holding on to. It's like, I got this disc. They've identified themselves as a person with a disc, and now I'm the one that has to say, like, you may not have the right map here. You may have a map of Chicago, but we're in New York City. So yeah, so I think that it's pretty well known that we can have those kind of changes. You can have arthritis, those kind of things, but not always have pain. And sometimes they can act like kindling to a fire, where they can be symptomatic. They can go a long time without being symptomatic, and then someone falls down the stairs, or someone gets into a car accident or something, and or they're not sleeping, they're super stressed at work, and they're pushing training that particular mesocycle, and they're really trying to hit some PRs. Now all of a sudden that disc, those few herniated discs or that rotator cuff tear that maybe you had and never knew about, now maybe it becomes symptomatic because all those ingredients are getting put into that pot there.
Yeah.
So it is tricky, and I don't, similar to how we started the conversation with those different modalities like foam rolling and whatnot. You don't want to dismiss a herniated disc or a rotator cuff tear because sometimes it is the issue. So that's probably something else that I've changed my mind on. A lot of times I would just completely dismiss the MRIs and I would say, you know what? No red flags, no tumors, no fractures, no infections. The disc is irrelevant. We're going to treat what we see in the office and we're going to go from there day to day. But sometimes it is. Sometimes it is the thing. I've seen patients go have injections and surgeries and they come out like new people. Wouldn't have predicted that one, but as long as you're feeling good. So yeah, sometimes it is. Like I don't want to go down that rabbit hole of being too swung on the other end of the pendulum because sometimes it is structural. But I think there should be a time period when you try conservatively first and treat the symptoms and don't worry about the structures just yet to see. That's almost like a last resort. Like if conventional therapy is not helping and you're trying all these different things and it's just not getting better, it's getting worse, then I think it may be time for some imaging. Perhaps, like I said, an injection or medication or last resort would be some kind of surgery.
Yeah. I think the general gist, right, is like go in with an open mind and let's not latch on to one answer. Because oftentimes, like, we want there to be one thing. Like, it's human nature. We just want the one answer, the magic pill, right? But to go in with that open mind, because I think in all reality, when you really ask people, most people want to exhaust every option before they go into a surgery, right? So I think it aligns there. But it's tricky because, like even like you said, when it is that situation, like my brain always goes to devil's advocate. It's like, but even if it was structural, how much of it was influenced by their beliefs that it was structural? They go into the surgery, now they think they're healed, and so like the brain and the nervous system's relationship to pain. Can you speak on that?
Yeah.
Like how our beliefs, our nervous system state can actually influence that too?
Yeah. So what you just said is a great point and one that I've wrestled with in my mind for a while. But if you think about it now, so if you have a patient who is just set on believing that this disc in their back is pushing on their nerve because they watched a YouTube video and the jelly squirting out of their disc and crushing their nerve, and that's why they have pain. You try your best to teach them that it's not always the case. You try your best to show them that you can get better and still have that disc in there. You show them examples of patients that have done that and it's just not working. Perhaps the surgery for that person is the best option, even though they may not have needed it. For that patient, that's the answer, which is kind of weird to think. Like, why do we do surgeries? Is it because the structure is so damaged that we need surgery? Or is it that the person is, what's the word? The person is not biased. The person is just a good surgical candidate. The opposite would be someone coming in saying, oh, I've been to PT a couple of times in my life. My daughter's a physical therapist. I believe in physical therapy so much. Like, I got back pain, but let's get after it. Okay, like that person's probably never going to have surgery. So yeah, it's interesting to see like why are we actually doing these surgeries and then which patients do better after surgery. It probably has a lot to do with the individual. So you asked me, the beliefs. One example, again, from my life that I like to share. Do you know anything about cars? Are you good with cars?
My husband knows a lot about cars, so I
Nice.
might have picked up a thing or two.
He may appreciate the story. So I don't know much about cars. So I went to get an oil change just a couple years ago. My car is a 2004 RAV4. I got it in high school. Actually, I got it when I got it in high school. I was driving around this older car for my first car in case I got into some fender benders. But this RAV4 was sitting in my driveway just waiting for me to go to college to use. It was a shiny silver RAV4, beautiful, and brand new at the time. So a tree falls on the car that I was driving. So the original deal was that I was going to drive the RAV4 in college. Tree falls on the rinky-dink car that I was driving. So I drove my car now since high school. So anyway, not the point. So I'm a bit more sensitive when things start sounding weird or smelling weird with my car because it's over 20 years old. So I was smelling gas, like something burning at the time. And I'm like, great, this is it. Like, this is the last thing I need is for another expense. I got to buy a new car because the car is shot. Like, it's lasted me this long, and now I got to get a new car. Immediately, I smell something burning, and that's my first thought. It's like the engine's shot. Like, this is not good. So I'm driving it around, and I'm trying to, hopefully it goes away. Maybe it was something on the road. Nothing. I'm still smelling this real bad burning smell, and even like seeing some smoke like come up from my hood. Fantastic. This is it. So I go into my mechanic, I call him up, and he gets me in like last minute. Yeah, come on down, bring it down. Thank goodness. I think my car's gonna explode, right? So like I'm going into the mechanic, and he opens the hood, taking a look at it, and he's like, Nick, come here for a second. And he shows me what happened. And I had just gotten an oil change, and the people who did the oil change forgot to put the top back on the wherever they put the oil in. So as I was driving, there was like spurts of oil shooting out and landing on my engine, which was then getting hot and causing that burning smell. So my mechanic screwed the top back on, and he said, "You're good to go." But the point of that story is that when people have pain, all of a sudden their beliefs kick in. And I thought my car was going to explode. I thought I needed a new car. I was thinking about what kind of car should I get? Should I stick with a Toyota? And I'm going down these steps here without even getting a diagnosis yet.
Yeah.
So by me going into my mechanic, I was really vulnerable. He could have taken me for everything I'm worth. He could have said, yeah, like, we got to fix this. We got to change that. It's going to be a couple of weeks without a car, Nick. I'm really sorry to break that to you. But all he had to do was just give me some reassurance and education. And that stopped everything. That stopped every single thought that I had, which were very real thoughts and very real feelings too. Like that feeling you get when you think you're going to have a big expense or you need a new car or something like that. That was all real, Marissa. Like that was real stuff I was feeling, all based off of a completely wrong perspective.
Yeah.
So I think bringing that back to pain and patient care, sometimes it's just a matter of hearing their beliefs, and that's a huge part of it, is just listening. Sometimes I won't offer my opinion until the second or third visit. If I don't feel like they're being heard, I'll just listen, be an active listener for those couple visits. But that's the most important thing, is make sure they feel heard. And I'm not going to tell them that what they're saying is wrong. I'm going to get as much out of them as I can, let them feel safe, and then offer my thoughts after that. But beliefs are a son of a gun. And sometimes it's just a matter of changing that perspective and exploring why they feel like that. Why do you think that your car is going to explode? Why do you think that you're going to be in a wheelchair for the rest of your life? And then just offering some education, offering a different perspective can completely change someone's outlook.
Mm-hmm. Yeah. Yeah, I love that too. And especially just like the listening part, because at the end of the day, like most of social media nowadays and a lot of practitioners out there are very quick to give our opinion, right? It's like, this is wrong, that's wrong, you're wrong about this. And that's why, I mean, specifically like in my niche, like just so many women just feel like, I've been told this, I've been told that, I've been told that, and they still feel lost. It's only until we like really slow down and just listen that they usually have a lot of answers on their own. They just haven't been listening to them. They've just been told a lot of things. So I love that. But yeah, the beliefs I think can influence so much. And I think it plays in hand with, I know you've probably seen just like the popularity of the nervous system lately, of fight or flight, of being stressed, being the worst thing in the world for your health, for your fat loss, for all these things. But I'd love for you to shed a little bit of light on that, of like, how does the nervous system influence pain? Does it create or amplify pain even if there's no damage, if we're in that stress state, or like how does that play into things?
Yeah, it's a good question. And I don't think it's that well known exactly how it works like that. We do know that stress can make things more sensitive.
Mm-hmm.
And we do know that, but at the same time, stress and sleep are not this end all be all. I think sometimes when people feel that they're stressed or people don't sleep well, then they think now everything is shot. I'm going to gain all this weight because of cortisol, and I'm going to get hurt if I try to train in the sleep deprived state. I'm an N of one. I get that. But the amount of PRs I've hit on like 4 hours of sleep, like going into workouts, saying to myself, well, we'll see what we got today. And then all of a sudden, like, it just ends up being a great workout. And I'm like, I slept less than 4 hours last night. How is this happening? And even times of stress too. So I think the body has a way of adapting, and we're way more resilient than I think we think sometimes. Now, I'm not saying that you shouldn't focus on sleep and stress, but if life doesn't allow you to be completely like a monk and no stress, or if you don't sleep well, I don't want you to think that all of a sudden you can't perform, or you're at risk for injury. I'm not too much of a fan of those devices that give you like a sleep rating when you wake
Yeah.
up in the morning, because what kind of day is that? Like, you wake up and it's like, oh, I slept like a two tonight. Like, well, there goes that big presentation I have to give at work.
Yeah.
So yeah, the nuances of the nervous system, there may be people out there that could speak to it, but I'm definitely not an expert in that. But I do know that we are way more resilient than we may think, and I think it's that kind of pendulum swing, like we talked about in other aspects. How initially it was all work harder, bro, and
Yeah.
pre-workouts and all this, all that, and then and no attention to stress and sleep. And now it's kind of the other end of the spectrum, where it's like sleep and stress management is everything, like even more than like calorie deficit. Like, yeah, don't worry about that, like just make sure you sleep and you don't stress.
Yeah.
Which is also not the case, because again, I know I'm an N of one, but I don't think I'm some kind of freak. But I did a whole contest prep sleeping less than 5 hours, and yeah, I think our bodies can adapt to things. And again, I'm not proud of that.
Yeah.
I'm not proud of that. But life is life, and it's a phase of life that I'm in. And if bodybuilding is something that I'm passionate about, I'm going to make it work somehow. So it's not a long term strategy, but the point is that I was able to do it with not much sleep, but
Yeah.
maybe not ideal, but it's not an end all be all.
I think it's an important point that you make, though. Like, just kind of looking at the industry as a whole, zooming out a little bit. I think we're not quite in the middle of that pendulum swing yet. Like, we really have come all the way to the other side of, sleep and stress management and your hormones and all of those things. While like the science on it and what we're learning about it is super cool, very interesting stuff. But we're valuing that over some of the basics now, and so it's like we're trying to come back to that middle here. But I think something I really like about this whole conversation is like the topic is pain, but it keeps evolving back to this conversation around like mental flexibility and how our perspective shapes everything, right? And that's something I'm a huge fan of. And I think it might be throwing some people for a loop right now, because it's like, I just wanted to know, like, what do I do about my back pain? But it really is like, it's not that it's all in your head or that we're trying to talk down on the fact that like you have pain. It's the fact that maybe we have more control in that situation than we thought if we do zoom out and we do look at the bigger picture. Is that right?
Yeah, 100%. I think it's all like the principles of it all. One way to think about it is, so everything that we've talked about so far, certain exercises for back pain, or different strategies that we use for low back pain. Think of that like the pieces of a birdhouse. You got the roof, you got the walls, you got the front porch, you got the little stick that the bird sits on. Those are all the pieces of the house: the screws, the hammer, the drill. But the principles, which is what we just covered, those are things like, if I turn a screw to the right, it goes in. If I turn a screw to the left, it comes out. These principles are present whether we acknowledge them or not. So it's important to have that understanding first, I think, before anything else, because then you could be going down a road that you're not going to get the long term result that you want.
Yeah. I remember that analogy from 4 years ago, the screw going in and out being the principles.
Yeah,
I love that that one stuck with you. So on that note, right, like we're kind of talking, we talked a lot about like what is pain? How do we really define it? How do we understand it a little bit better? But I was such a big fan of like when I personally worked with you for some of my low back pain and my herniated discs. If y'all don't know, I have two of them. I'm actually, actually this is going to be a fun update. knock on wood, I am symptom free since probably 2021, since like fixing all of that or like getting to the root of all of it. I will say that a lot of it did have to do with allostatic load management of how much am I asking of my body at any given point in time. But I haven't had anything close to a flare up in years. Just
Nice
a
job. Excellent. I'm
note
so
there.
proud
Yeah.
of you.
But with that, right, your approach was different than other physical therapists that I've been to. I've been in and out of physical therapy, like, and working with you was some of the most well-rounded approach that I've ever had. So I guess kind of walk us through like what's your process for bringing someone out of their pain?
Yeah, well, thank you for that. I really appreciate that. And it's so nice to hear that you're feeling that good.
Yeah, now we're working on a shoulder, but we'll get there.
um, yeah, so my process. So everyone's so different. And I guess what I start with is I want to hear everything. So bring me up to speed on what's been going on. And then how it started, when it started, what are the characteristics of the pain. But before all of that, I usually will ask how it's affecting them in general. My first time I open my mouth, usually after, so tell me what's going on,
Hmm.
is I'm sorry you're going through that. It really seems like that shoulder is limiting you from doing things that you love. Or I'm so sorry to hear that your back has been acting up for that long. And I definitely see how it's impacting your ability to play with your grandkids. That must be so hard to watch them run around and you want to just play with them but you're stuck on the chair. That's how I start the conversation. And then it opens it
Empathy.
up to, yeah. And then it opens it up to more of their goals. Like, what do they want to get back to doing without me asking them, what do you want to get back to doing? Yeah, Nick, I really want to just play with my grandkids. And then I got my dog who I haven't been able to walk because my back hurts. And what kind of dog do you have? Oh, a golden retriever, had them my whole life. And actually, one of my dogs just died last week. And oh my God, okay, time out. Like, now we're starting to figure out, okay, there's maybe more to this than just a low back flare.
Mhm.
They have this stress that they're not a good grandparent. Maybe the grandparents on the other side of the family are way more active and fit and they feel like they can't keep up because they're pain. Their dog just died that they've had for 15 years. So they have stress because of that and sadness and they're grieving because of that. So just by going in and asking, so what kind of things aggravate your pain and what kind of things make it better? We're not really getting to that person. And that's all developing rapport and developing that relationship and that trust and that alliance between the provider and the patient. And it's so important.
Yeah.
Yeah, so that's usually where I'll start. I try to get to know them, see what this pain means to them. How is it limiting them? If it's just limiting them from benching and they can do everything else and they're just like, yeah, bro, I just want to chain chest on Monday and I can't do it. It's like, all right, like let's dive into your training. But for the most part, I try to get deeper and just try to see like what this pain means to them and how it's affecting their life. And then I like to rule out red flags. So like we talked about before, I'll ask questions that will either make me think it's something a bit more sinister that we need to get checked out or something that we can kind of move forward with. So we talked about that before. Some things maybe before that I didn't mention, any kind of trauma. So if you were asymptomatic and then you tripped and fell, or like I said before, in a car accident, and now you have this achy kind of pain that you don't really know, that may be something. Like maybe just get an X-ray, make sure you didn't fracture something, or like real bad bruising, like those kind of things. But for the most part, and then probably majority of your listeners and people that I work with, we don't have red flags. So we can proceed. And then what I'll say then, once we start talking about the pain and the physical part of it, I'll say, what kind of things provoke your pain? What kind of things make it worse? What kind of things make it better? And then we'll talk about that will lead into different like functional deficits. So whether it's negotiating stairs, whether it's picking up groceries from the floor, or if it's just someone with training. So, well, it hurts when I do a flat bench press, but it feels okay when I do incline bench. I can do a barbell, but I can't do dumbbells. I can't do any kind of pressing, but I could do pulling. Then we start that conversation. We start to see what they can do and what they can't do, and what things that they can't do. For example, if it's a flat bench press that they have pain with, I'll ask, when do you feel the pain during the movement? Is it, well, first, is it during the movement or is it after you train? If it's after they train, so say they train chest and then they feel great during the session, but then afterwards they have pain for the next day. It's like a sharp pain in their shoulder then I would look more toward overall volume, rest in between sessions, and just try to see if maybe we're just kind of overloading ourselves a bit too much, because it's not an acute thing where like you move your arm and you feel pain. It's more like the after effect of the training. So I'd kind of look into more of that. Maybe some like gentle stretching, some cooling down after a training session, just to kind of bring it back down a little bit. If it's pain during the movement, then it's a bit easier to kind of work around. So yeah, it hurts right at the bottom of my bench press. Okay, so what if we put a block on your chest and go down, don't change anything else, just try limiting the range of motion. If that works, fantastic. Use that block when you bench for the next week and see how it feels. And then the following week, if you're still asymptomatic with the block, then we'll slowly remove it. So maybe we do 3 sets with the block, 1 set without the block. And then the next week, maybe 2 sets with the block, 2 sets without the block. And we kind of work it out like that, all depending on the symptoms. If it hurts, maybe we pull back a little bit. If it feels good, maybe we push a little bit. If the block example didn't work, then we go down the line and we try load. Maybe we decrease the load a little bit. Maybe we change the exercise up. Maybe we use a machine press instead of a bench press. But I always will ask, is the barbell flat bench press something that's important to you? Or would you be okay doing something different? If they're a power lifter, we don't have that much freedom. Yeah. We can train other things, but we got to get back to the bench press in one way or another. Or if someone's like, nah, I really don't care. I just saw it on a YouTube video that the bench press is the best thing for your chest, so I just started doing them. All right, cool. Like, have you ever used the machine? No. Okay, your world's about to change. So it really depends on the movement. So it's always good to know, like, do we have the freedom to bail on the movement? Because sometimes we're just chasing this leprechaun of a pain-free bench press or a pain-free squat, when if the goal is just to build strength and size in your chest or build strength and size in your legs, I can show you 100 different ways to do that without doing the squat or the bench press, which would be way easier, way less time. And we can always go back to those movements later, but why are we wasting time? Let's just move on to something else. Especially if that's the only thing that's causing the pain, then it's always good to know that we can bail on a movement if we have to.
And do you find that when you bail on a move, like let's say you bail on a movement with a patient and you're able to train those muscles more effectively, do you find that that patient is then able to come back to that movement down the road because they've trained the musculature better and then return to it with less pain, or be able to like retrain that movement pattern?
Almost 100% of the time.
Yeah.
Yeah.
Okay. That's kind of what I was thinking there too, because like that was kind of similar to where my lower back pain, I couldn't really back squat, deadlift all too much without a lot of symptoms after the fact, but just spent honestly a lot of time with split squats and hip thrusts. And now I can get under the barbell. I still don't do it all that much because I don't care. But at the same time, I can, and I can do it pain free because of that.
Yeah. And that's that flexibility that we're talking about. If you were so rigid and only wanted to barbell back squat, you would be causing yourself a lot of pain and a lot of distress, and your training wouldn't be as enjoyable, and it would just get worse, and then it would bleed into your life, and you can't go for a walk with your husband because your back hurts because you want to squat with a barbell on your back. So yeah, I think that flexibility is when it comes to that. And for me, I train in my basement. So I have a small little setup of the basics since my kids, and I'm limited in what I can do. I don't have 3 different machines. I got a barbell squat, I got some split squats, and leg extension, leg curl variations. That's about it for my legs. So I'm always a bit more, not nervous, but if I were to get pain with a squat, I have way less options. So, but if you have the options, then it's great. There's no need to be married to a certain kind of movement. So yeah, it definitely depends on the equipment available. But I've never come to an instance with a patient or myself where we couldn't find some kind of movement pattern that felt good to train the same muscle.
Yeah. Yeah, definitely. I think it's, again, it's just funny. We're coming back to like mental flexibility as just a principle of this conversation around pain. Because again, like, what's the overall goal? Usually get stronger, get leaner, get healthier. Like, we don't necessarily need to do things just one way to get there. So I
Yeah,
think,
just real
go ahead.
quick. For the longest time, I forced the squat, and I tried all different stances, and like it was always very I never really felt it in my legs. Like it's always I just did it
Yeah.
because I had to do it.
Yeah.
And then I started using a heel lift. And I never wanted to do that because I always felt, as crazy as it sounds, I always felt like if I was on a desert island and I had to squat, like I didn't want to get used to the heel lift because then I would lose my ability to squat without a heel lift. For years, Marissa, I didn't want to use a lift because of that. And then, I don't know, I think it may have been when I started training at my house. I just used a lift and my world was changed forever. It's just such a more comfortable movement.
It is. Yeah.
And it just comes down to that flexibility and like letting go of some of these beliefs that you may have, not you, but that we may have. And it really is just freeing. Yeah. So if there's anything that you feel or any listeners feel like is just true and you can't challenge it, like maybe just question it because you may open a whole door of comfort and enjoyment and less rigidity.
Definitely. Just add a little question mark in there, right?
Yeah,
Um,
exactly.
get curious is always what I say. So I want to make sure I'm respectful of your time as well, but I want our listeners to know where to find you if they want more of this sort of content. So where can our listeners find you?
Sure. So my Instagram is just at Nick Licamelli and or 3dmusclejourney.com. I have a lot of work there as well. They have the 3DMJ Vault, which is their subscription, and they have different courses in there. I have a few courses in there. It's I know I'm biased, but it's the it's awesome. I mean, you got Eric Helms, like Alberto, Jeff, Brad, everyone's brains just Brian. It's in there in all different courses, and the only problem is there's not enough hours in the day to absorb it all as fast as you want to. So I'd highly recommend the Vault, or like I said, my Instagram. I do online work with people, so if you have any questions, if you're dealing with anything, if you want to follow up with anything that we talked about today, I'd be more than happy to chat. Just feel free to shoot me a message.
Love it. Yeah. I would highly recommend if you're needing any sort of, and I was surprised too. Virtual care for physical therapy was a big question mark in my mind, but it worked for me. So awesome. All right. Well, thank you guys so much for listening to this episode of the PCC podcast. Again, we'll have Nick's information in the show notes and we'll see you back here next week.